So the next session, we're going to cover something called a pain flare. Now, while all of you will have chronic pain, what we do know is that the course of chronic pain is not always smooth. Some days are better than others, and as we've mentioned in the pacing lectures, there are good days and there are bad days. There is a difference though between having a bad day and a pain flare. So a pain flare is a temporary increase in the pain intensity from a more stable baseline, but it otherwise has very similar characteristics to your usual pain. We need to be clear here that it's not caused by any progressive disease or a new condition. This is a flare of your usual pain. It's often similar to your normal pain in quality and distribution, but worse in intensity and sometimes more prolonged in length. So what happens? The onset may be gradual or it may be sudden. So it may sneak up on you over a few days, or it may happen very quickly. There may be no causative factor that you can think of, or you may be able to identify a cause. It can last from a few minutes to hours to a few days and even to several weeks sometimes. It could be triggered by both over or under activity, illness or stress. In relation to illness and stress, what we know is that from the earlier sessions that you only have a certain amount of coping. If we remember the bucket that Maria was using with the stress and the anxiety, illness and stress cause both physical and mental or psychological coping to be a little more difficult. So what happens? As I've mentioned, the cause is not always identifiable. Hopefully, if you've been through your pacing and your activity diary, you may well have been able to identify certain actions or times of the day where the pain gets worse, and you can actually identify those causative triggers. Sometimes, however, there is no identifiable cause that you can think of. The pain flares can be very frightening. The pain is getting worse, you don't feel like you've done anything different, and understandably, it feels as if things are worsening, your condition is worsening. However, what happens with this worry is that stress and anxiety can increase, and as we've heard already, these can then worsen the pain and you end up in a vicious cycle. The goal of pain flare management has 3 stages. So number 1 is to rule out any serious or underlying pathology, so to make sure that nothing has changed. Number 2 is to try and survive and get through the current flare. And then number 3 is to plan to reduce the likelihood of any future occurrences. So in order to rule out any new pathology or anything new that's going on and make sure that it is a flare of your pain, there are a few questions that you need to ask yourself. Is this my usual pain? Is it in the usual place? Does it feel like it usually does, but worse? Maybe the episode is just prolonged compared to how it has been before. And thirdly, have you had any other symptoms? So a fever or a temperature, sweats, vomiting, any new symptoms that are unexplained? If the answer to these is no, then it is most likely a pain flare. Please take a moment to watch the video and listen to what this patient has to say about their way of managing a pain flare. We know that pain and pain management are very individual and subjective, and there are other ways of managing, but they have some helpful hints and tips and pointers.
First and foremost, I think if you're having a flare-up, you draw on the experiences of the flare-ups in the past, and you do all the things that you know will help you, like pacing yourself and relaxation and listening to music, any form of distraction at all that you find pleasurable, looking at grandchildren, photographs of grandchildren, anything like that. And it depends on how bad the flare-up is. If the first 3 or 4 days can be crucial in what you do and in how you're going to react and how long this flare-up could last. And I have always thought, as long as I pace but keep myself mobile, because mobility can be very easily lost and it can take an awful lot of hard work and effort to get it back again. So I would say that keeping mobile, but no strenuously, really cautioning yourself to a certain degree, but not to a degree where you're just going to lie in bed or anything like that.
Okay, flare-ups, we're all going to get them. Is it realistic that people with pain, whether you've been on a super-duper pain management program or a super-duper self-management program, you're never going to get a flare-up ever again in your life? No, false, incorrect. We are overachievers, we will overdo things and we will get flare-ups. And it's how do you, part of self-managing, part of pain management is how you deal with that flare-up. Most people, when they go at a flare-up stage, the first thing to do is panic. Oh my God, what have I done now? But what you have to do is stay relaxed. But you need a plan, you need a flare-up plan. When I get a flare-up, right, I'm going to be dead honest there with you. Do I panic for a split second? Yes, I do. I go, oh, what have I done? Then I have to talk to myself and say, well, hang on a minute here, son. It's okay, you've done something here, it ain't quite right. Right, okay, easy does it, relax. What I do personally is I put ice on my back, wrap it round, got little gel packs, wrap them around in a tea towel and put them on my back, lay on the floor with my knees bent, and just lay there for 5 or 10 minutes just to snap, you know, do the inflammation, get the inflammation down. What I do though is I do some stretching, carry on stretching. I reduce exercises by about half. So let's say I'm doing strengthening exercises. I do say I'm up to 20. I'll probably reduce it by 10, but then I'll increase it one a day after the flare-up's starting to ease off. Flare-ups normally, for me, I know it sounds like I'm being big-headed again, but my flare-ups only last for about an hour or so, and then they go. You know, I just get on with things. The reason why they're so quick now is because I'm fitter. And they say that the fitter you are, the less time you'll need to recover. The less fit you are, the long chances are your flare-up will stay on for longer.
A number of the pain management strategies that we have spoken about and talked through in these sessions are also applicable when we're talking about managing pain flares. So pacing, which is a key technique and can prevent future pain flares. This is mostly preventative. Pacing when you've had a flare it's too late and it should be a preventative measure. It can be tempting to try and stop most of your activities when your pain has flared, but unfortunately this will probably lead to the pain being prolonged and it will be much more likely to occur again because all you are doing is further deconditioning the muscles that are already stressed and tensed from the pain flare. It's important to try and do as much as you can during the pain flare while not overdoing it, as is the general idea with the pacing. So modifying your activities by taking frequent breaks before, during or after a pain flare is essential. Another useful technique for helping you to manage the pain flare is a relaxation. So techniques such as breathing or guided muscle relaxation can be really effective at reducing the stress and tension associated with these pain flares. Other behavioural techniques such as guided imagery and hypnosis can also be useful, but again these are skills that need to be learnt, and during a pain flare is not the time to try and add these to your repertoire. These are things that need to be tried and tested while your pain is at its usual manageable level, rather than trying to instigate them when your pain has flared. Next is distraction. Now we know that distraction is one of the most effective ways of managing pain and pain flares. However, there's very little evidence to support this clinical feeling. Distraction is linking back to the feeling that pain demands attention. So when your pain is flaring, it's going to demand more of your attention. The more we can distract away from the pain and onto more pleasurable activities, it's going to reduce that pain intensity and all the other symptoms that come along with it. We would suggest and advise that you try not to disengage with your usual activities, as shutting yourself away and not doing the things you enjoy will only cause the flare to prolong more likely. In fact, it's probably better to try and do small and often periods of activity, especially those that you find enjoyable. If you can, try and find someone to talk to. We recognise that communication is often difficult in people with chronic pain. If this is something that you're struggling with, please let us know during one of your reviews and we can run through some of our hints and tips and possibly give you some helpful advice. There are some slightly more active things that you can do in regards to managing the pain, and one of those that you may well have been mentioned in your consultation with the doctor would be the transcutaneous electrical nerve stimulation, or TENS machine. This acts by transmitting a very small electrical impulse via a couple of pads that we placed in the relevant position on your body. This sensation kind of overrides the pain. It's a slightly stronger sensation than the pain and may just cause the pain to quieten down slightly. This will often work quicker than any medication. If the pads are in the right place and the TENS is effective for you, this can be very effective and very quick. The benefit of this is there are no side effects, so it's not like any of the medication that will often give you side effects and other symptoms that we then need to deal with. Apart from the TENS, other techniques that you can try that work very quickly and are non-pharmacological, so not drug-based, include heat and cold. So an ice pack that you keep in the freezer can just be brought out and placed on the area. This has the effect of reducing any inflammation or swelling that may be associated with the pain flare. Heat is slightly more complex in the way that it works, but what it does is it stimulates different nerves that kind of override the pain message. Some people find heat more effective, some people find cold. It's very much a case of trial and error. So although we don't focus on medication throughout these sessions, flare management is one part where there is a place for medication. Sometimes the use of medication on a short-term basis can be part of your flare management plan. Hopefully the other things that we've spoken about and discussed will be effective and there'll be no need to alter any medication that you're on. If your medication is increased to manage the flare, it's very important that it's reduced back down to its baseline level after the flare is resolved. Otherwise you end up on an escalator of your medication and on ever-increasing doses, which again increases the risk of those side effects. It can be helpful to develop a flare plan. So this is a management plan for when your pain flares. It's important that this is done when your pain is at its baseline level. As we've spoken about, pain demands attention and your thinking can sometimes be clouded when the pain is at its worst. So what are the benefits? So a plan can help you feel in control. So it's something written, something solid and concrete that you can go to and rely on when your pain is flaring. The processor plan sometimes gives you a feeling of control as well and gives you a say in your pain management. Within the booklet that you were given at the first nurse, there is a template for a pain flare management plan, and the link, if you weren't given it, is here. Please take a moment to read this and fill it in as you see fit. So in order to reduce the likelihood and the duration of future flares, we need to identify the possible triggers. It's important just to take time to think about your last pain flare and what happened before or during this. A flare diary can be very helpful, as sometimes having things written down gives us a much greater insight into what's happening as opposed to our memory, which can sometimes be clouded by pain.